Well, good morning, everybody. And I just first want to start by thanking the executives of the top health insurance companies in America for being here on short notice to have this conversation, and also colleagues from the National Association of Insurance Commissioners to be here today. The meeting was really prompted in part by the rate increases which have been announced around the country, and the input that I've had from people across America who are really frightened that they're being priced out of the market, don't know what's coming next, want some information about how this is happening and what strategies we have for looking at costs into the future, because they're terrified that they're next. If they're not affected directly right now, what's going to happen next? And clearly it isn't one state or one company or one isolated situation. I think the individual and small group market is seeing double-digit rate increases across the board. And it's one of the reasons that the President is very eager to have a comprehensive health reform bill that, among other things, has a new marketplace and has a different kind of opportunity for people to be pulled together. But in the meantime, I think it's important to sort of figure out what ideas there are, what kind of information you can share with me and I can share with Americans about what exactly is happening and how we can deal with this going forward. So I appreciate the effort that you've made to be here. I think we're eager to talk about what's happening in the marketplace, what you're seeing in terms of cost trends, loss trends. I think that I've had some experience. I know a number of you, both as a governor when I dealt with a large state employee plan and we negotiated rates with a lot of companies, certainly as insurance commissioner and as the former president of the National Association and dealing with health insurance during that period of time, had an opportunity for these conversations. So I didn't ever realize I'd kind of be in this situation, but we also have major programs that we run with both Medicare and Medicaid, and a number of the companies are involved in that. So I think this conversation is not only critical to the American people, but a very timely opportunity for us to be together, and look forward to exchanging ideas and information and seeing, where we can go to make sure that Americans continue to have some options for affordable, quality health coverage into the future. And with that, I'd like to recognize Sandy Prager, the commissioner of the great state of Kansas. Sandy actually came into the position of insurance commissioner when I became governor. We served together in the legislature. We've known each other for a long time. Immediate past president, or maybe immediate two terms past president, but I think still chairs the health committee at the NAIC. And Sandy, thank you for being here today.
Thank you, Madam Secretary. I must tell you, it's a comfort for those of us at the NAIC to have you in your position, because we know you do understand insurance and the critical role that we play. So I want to thank you for holding the meeting and for including me and my colleagues from West Virginia and Pennsylvania in this really important discussion. The American people really are reaching out and are reaching the breaking point when it comes to the cost of health care and health insurance. It becomes increasingly important for regulators to thoroughly and objectively review the insurer's request for higher premiums to ensure that the increases are justified by their actual medical expenses and that they don't unfairly discriminate against any groups of policyholders, especially during this financial downturn. State regulators are best positioned to perform rate review. Many of us do so with great success. Some, however, have not been given the authority by their state legislatures to review and deny unjustified increases before they become law. And we believe that a federal backstop could encourage those legislatures to provide that authority. What's absolutely critical, however, is that the state role in assuring the solvency of health plans and promoting competitive markets be preserved. It's really important in terms of protecting consumers from high premiums, but it's even more important to protect them from insolvencies. The only thing worse than paying a high premium for health insurance is paying a high premium and then having the insurer not be able to pay your claim. So rate review must be done on an objective actuarial basis, not through arbitrary limitations on premiums that don't account for underlying costs. We've been working with the administration and with Senator Feinstein and with Representative Schakowsky, and we believe that their proposal will be the kind of state-federal partnership that is necessary to protect consumers. As important as rate oversight is, it will ultimately fail unless the markets are stabilized. Key provisions of the President's plan and in the bills in Congress would help provide the stability by ending discrimination based on health status, pooling risk more broadly, bringing everyone into the market, and ensuring that most of the premium dollar goes to pay claims. In the end, however, the real key will be bending the cost curve, and we've all heard that term, so that our delivery system provides better quality care with greater efficiency. Unless we do so, premiums will continue to rise uncontrollably with or without reform. So again, we thank you for holding this important meeting and including us in the discussion. Our colleagues at the NAIC really look forward to working with you and with Congress to bring this effort across the finish line.
Well, thank you, Sandy. And Ron Williams, who is the CEO of Aetna, is going to give some comments. And I appreciate Ron not only being here, but being part of this dialogue really for the last year or more. And I've had the pleasure of working with Ron over a number of years. So welcome today. Thank you for being here. I'll turn it over to you.
Well, thank you, Madam Secretary, and I appreciate the opportunity to be here on behalf of my colleagues and this opportunity to work with the commissioners as well. I think we're pleased to be here today because we really share a common purpose, and that is making certain that working families have access to affordable health care. We recognize that there are issues in particularly the individual insurance market that need to be addressed, and that's why the industry last year really came forward and supported many of the proposals to eliminate the use of health status as a condition for getting health insurance. We recognize that in order to make that work, we do need to broaden the participation in the overall health insurance pool. As organizations, we're really only successful when we meet our customers' needs, and today that means affordable health insurance. We also support taking the bureaucracy out of healthcare through administrative simplification. And the industry has spent over $2 billion to ensure that every member has ultimately access to a secure personal health record. Fundamentally, we want the insurance market to work for everyone. And in order to do this, we really do believe that not only must we address the access issues, where I think we're making some important progress in some of the proposals, but that we really get at what's driving medical costs. And we recognize that the consumer experiences that in the premium rate. But the rate is really reflective of our other parts of the healthcare delivery system. The pharmaceutical companies, the hospitals, the physicians, the device manufacturers, who all need to be part of this collaboration to really help make healthcare more affordable for working families. I think last week I was struck by the comment of Warren Buffett, who really, I think, said it best, that insurance itself isn't the problem. It's the problem at the point of care. Insurance isn't the reason that health care is at 17% of GDP. The reason is that we do things that don't need to be done in terms of paying for procedures and not paying for results. What we really want is a system that incents physicians to apply their best clinical judgment to deliver the best quality care for all of our citizens. I really just want to close by thanking the commissioners, the National Association of Commissioners, for working collaboratively with us, and I would say making certain we're compliant with all state laws, all state regulations, and having a firm hand to the extent that we're not doing the things that we should be doing. I really want to applaud you, Secretary, for this collaborative process. I think this is what we need more of, is everyone at the table collaborating, working together to really do what we can to make certain that the rate increases slow down, which means the cost of care must come down. Thank you.
Well, thank you very much, Ron. And I think we'll pause for a minute and let the press exit.